The truth is, if you continue to seek traditional treatment, bipolar is a chronic disorder that you can never heal from. When you give the brain these medications, especially antidepressants, but all of these medications, they change the way that the brain functions. And when you withdraw it, the brain goes through withdrawal symptoms. And every time I would go through withdrawal symptoms from coming off of medication, it was always attributed to my bipolar. It was never considered the fault of the medication. So the truth is, if you continue to seek traditional treatment, bipolar is a chronic disorder that you can never heal from. And now I know that there are people out there with bipolar who find relief from taking medication. I know that that's true. But you can have a high fever and take ibuprofen and lower the fever. That doesn't mean that you're treating the underlying cause. It means that you're treating the symptom, and you have happened to find a treatment that is going to help the symptom. But you are not treating the underlying cause. And if you continue to do that, yes, you will have to take medication for the rest of your life, because you're not healing what's causing the symptoms in the first place. You're treating the symptoms. And the other problem is that these medications do damage to your mind and your body. And that's why so many people with bipolar end up with second and third diagnoses. People end up with tardive dyskinesis. They end up with liver problems. They end up with heart problems. They end up with, gaining weight and losing sexual function. There's all kinds of problems that these medications cause in our bodies. And we're not actually treating what's causing the symptoms of bipolar in the first place. So it is possible to heal if you use an integrated research-based approach to treating your bipolar that gets to the root cause of what's causing the symptoms. And my experience with it is that, number one, I needed to come up with a way to manage my mood swings in the first place. When I went through my terrible year in 2008, when I had my breakdown and I ended up in multiple hospitals and they did electroconvulsive therapy on me, I made a commitment that year that I was never going to give up, because I made 2 attempts on my life. And after my 3rd hospitalization, I was watching my little girl play with her brother. She was 4 years old at the time and he was 2. And I had this really clear thought come into my head that if I ever successfully ended my life, that it would ruin her life. And I was shocked by that thought, because I had become so thoroughly convinced by my unwell mind that everybody would be better off without me. And I honestly just wanted the suffering to end. But when I realized that I would ruin my daughter's life, I made a commitment there and then that I would never allow those thoughts to stay unchallenged again. I would never allow myself to get into a place where I would risk ending my life, because I knew, even though I didn't believe my life had value, I knew my daughter's life had value. And I wanted to live for her. So for the next 2 years, I just suffered. It was pretty rough. And I ended up back in 2010, I ended up back in the hospital again. And I thought, I have got to figure out how to manage this. I've got to figure out how to survive. I know that the mood swings are going to happen. So how do I be more proactive in managing it so that I'm not messing everybody's lives up every time this happens? So over time, I developed something I call the Mood Cycle Survival Guide. And it was a plan that I came up with that, number one, helped me identify who could help me and what the boundaries were around that assistance so that I didn't burn bridges and ruin relationships constantly. Number two, it was helping me identify the mood swings early. I created what I called the early warning system that helped me to recognize early on when I was starting to experience symptoms that indicated I was becoming hypomanic or depressed, so that I could start managing it sooner and minimize the impact. And then I also made sure that I identified, my step 3 was identifying what my power priorities were. So often when I would experience mood swings, when I was, manic, I would get big projects going and forget to feed myself and my kids. When I was depressed, I couldn't get out of bed. And so I identified what are the things that have to happen no matter what, so that my children still get cared for, so that the basic needs still get met. And then the last step of that plan was, how do I get myself back to a healthy, balanced place? And so I developed that plan for myself, and I started utilizing it to make sure that when I did experience symptoms, that I was minimizing the impact on myself and my family and shortening the duration of those cycles. And then the second step was getting off of the medication and getting my brain what it actually needed to start healing. And I need to make sure that you're very clear that if you ever choose to go off medication, you need help. Do not ever go off of medication cold turkey, because you will suffer consequences. The withdrawals can be horrible and sometimes life-threatening. My experience with it was working directly with True Hope. My doctor ended up deferring to them because he had no experience with cross titration. Cross titration is the process of coming off of meds very gradually and increasing the micronutrient dosage so that your brain heals and you minimize the impact of the withdrawals. It's still a rough process because you're withdrawing from a drug that has changed your brain chemistry. And so it's a really gradual process and it's rough. But on the other side of it is, I went through this for several months. And then one day I woke up and it felt like it was the first time I was fully awake in over a decade. I called my husband at work because I was so excited. I'm like, oh my gosh, my brain's healed. It wasn't actually healed all the way at that time. It still had a long ways to go, but it was such a dramatic difference for me that it felt like it was healed. And so over time, I gradually began to heal more and more, and my brain was getting what it needed finally to function in a healthy way. And then the third thing was learning how to use therapy in a healthy way. I didn't understand that therapy is a tool and that you need to learn how to use the tool. Prior to, gaining this insight into therapy, I was going when I was in crisis. I'd have some kind of crisis happen in my life. I would go start seeing a therapist. And then when the crisis was over, I would stop. I didn't know what I was doing. And sometimes I had doctors say, you need to go to the therapist, to gain coping skills so that you can handle the mood swings. But when I started to heal, when my brain started to really heal with the micronutrients, with that treatment, I started recognizing that I was triggering mood swings because I had unhealed trauma, unhealthy thought and behavior patterns, unhealthy coping mechanisms, and all of these things were triggering mood cycles in me, mood swings in me. They were triggering symptoms. And I needed to actually heal them in order to eliminate those triggers. And so I started therapy and thought I am going to keep going to therapy until there's nothing left to talk about. And I learned how to use the tool. And then the fourth thing is I learned how to practice mindfulness meditation, really learn how to use it. When I was earlier on with my disorder, I had therapists teach me like little mindfulness techniques. And I thought maybe they were helpful, but I wasn't really sure what I was doing. And then I discovered the work of Dr. Mark Williams and Danny Penman. And I had Danny Penman as a guest on my podcast. I'll link that in the show notes. But they've got 2 books out that teach through an 8-week self-guided program how to use what's called mindfulness-based cognitive therapy. They teach you the science behind why mindfulness meditation can help eliminate a lot of the symptoms of depression and anxiety. They can help heal it. And they teach you how to use it. It's amazing. It was life-changing for me. And the other thing that was a benefit from it, not only was I healing because of that, but I was also able to use my therapy more effectively because I became so much more aware of my thoughts, of triggers. So those tools started helping, working with each other and helping each other. And I gained more healing. And then I learned how to use yoga in an appropriate way. I had enjoyed yoga before, but I didn't really understand it until the first time I cried doing yoga. And I'm like, what is happening to me? And I started researching and recognizing yoga is a viable option for helping heal mental illness. There's aspects of your mental illness that can be healed through appropriate use of yoga. And then I learned how to use exercise in a healthy way. I used to train for triathlons, and I was inadvertently triggering hypomanic episodes every time I would train for the event. And when it was over, I would crash. You can't get on the roller coaster and jump off in the middle, I learned. And so then I learned that it was much better for me to have 30 minutes of moderate aerobic exercise a day. And that helped benefit me so much more with my mental health. And then I learned how to live mindfully. And this integrated, research-based approach helped my brain heal. So the answer to the question that I asked at the beginning is yes, it is possible to heal bipolar if you treat the things that are actually causing the symptoms to occur rather than just treating the symptoms. If you change the approach to treating bipolar, if you will use an integrated, scientifically based method, you can help heal your bipolar disorder.